In the next year and a half, we here at Healthcare Triage are going to take some deep dives into issues of health policy, especially those that touch on social determinants of health and health equity. These episodes will be a bit longer than usual. They'll look a little different. They also come to you thanks to the Robert Wood Johnson Foundation, which has generously supported their creation. We're excited about this opportunity to really dig in, and we hope you will be too. Not long ago, the RAND Corporation released a comprehensive report on early childhood programs. They're based on the idea that if we establish a strong foundation in the early years of life, the rewards can last for, well, a lifetime, and even across generations. Researchers were interested in the following questions. What works to promote the health of children? What programs exist that provide services to families and children that have been studied rigorously? How well do these programs work? And what are the benefits compared to the cost of the programs? I'll add another question. Why does this matter? Early childhood interventions are increasing in popularity across the country, in both liberal and conservative places, but questions still remain about the research behind them. So we're going to use those questions to frame our discussion of the work, and we're going to start by broadly talking about the first question, because it's hard to discuss whether early childhood programs work before we know what early childhood programs are. That's the topic of this week's Healthcare Triage. Basically, the RAND study updated and improved upon their previous systematic review. They went through all the research literature and identified studies of early childhood programs that had undergone rigorous evaluation, meaning studies like randomized controlled trials, providing evidence that the program caused, directly or indirectly, improvements to child health. What do we mean by rigorous evaluation? Let's get into the details. To be included in this work, a program needed to meet some specific criteria. It needed a specific name that distinguished it from other programs. It needed to target a child from birth to 5 years of age, a parent caregiver of a child in that age range, or parents who were expecting children in the very near future. It needed to focus on the population at large, not a special needs population. There's more. The evaluation also needed to meet some specific criteria. It had to use an experimental or quasi-experimental design. Basically, they wanted a randomized controlled trial, the gold standard for proving that an intervention works, or at least sophisticated techniques to try and get at causality. Studies had to be in the United States, and they had to measure at least one outcome prior to school entry. And that study had to be formally published. It's important to understand that many programs exist that have not been evaluated in a way that will allow us to determine their impact. The vast majority of private preschools, for instance, aren't really evidence-based. Some of them may be doing good, we just don't know. We want to explore the interventions for which there are data, and there are more than you think. All of the programs followed, for the most part, a certain framework. Let me quote from the report here because this framework is essential to understanding how early childhood programs work. Early childhood programs can contribute to child outcomes directly through child development inputs by increasing parenting capacity, or both. These included learning opportunities, game playing, or language exposure. Early childhood programs and parenting capacity can promote child development through both enriching activities and goods. These could include books or school supplies, for instance. Child development includes physical and mental health creation, as well as skill and knowledge building, and the latter includes both cognitive and behavioral and emotional components. These could include exercise, sleep, or even immunizations. Although not the primary goal of early childhood programs, those that increase parenting capacity can also improve parent outcomes. These can include income, health insurance, or the avoidance of substance abuse. The RAND study started with more than 1,500 programs, but winnowed the list down by the inclusion-exclusion criteria I already mentioned to 115 programs that were intended to improve outcomes for children. They were broken down into 4 categories: early care and education, home visiting, parent education, and transfers. Early care and education programs provide services in a group setting. Think of preschools or formal social playgroups. Such programs clearly work by directly impacting the children themselves. 35 of the studied programs fell into this category. Home visiting would include services in individual parents or families in the home, most often to improve skills or knowledge of parents or caregivers. They're usually done by healthcare or social service professionals. Most of the time, they expect to improve child outcomes indirectly through parents. There were 30 such programs studied. Parent education defined programs that provided services to parents to improve knowledge, either one-on-one or in groups, but outside the home. They also seek to improve outcomes on children indirectly. Unlike home visiting, though, these usually laser in on parenting skills in the home or parent outcomes. 18 programs fell into this category. Transfers included programs that provided benefits, either cash or vouchers for food, childcare, housing, or healthcare, to families with the intent of improving outcomes for the children and the families. These can have both a direct and indirect impact on child outcomes. 7 programs met this definition. You may have noticed that these don't total 115. You get a gold star in math. That's because 20% of the programs combine some of these approaches. Some were a combination of 2 of the first 3 approaches, and 3 even used all 3 of the first 3 approaches. Transfer programs were always just transfer programs, though. Some programs also had more than one group that went through the program that we could study. Some programs got evaluated more than once. Because of all those combinations, RAND established 205 evaluation cohorts, and that's a lot. But let's break things down even further. Before we get to outcomes, it's worth spending a little more time thinking about the different ways that early childhood programs work. For instance, who's the intended target? Most programs obviously would answer the child, parent, or both. But in about 20% of programs, targets included teachers or healthcare providers. Programs differed by the age of first intervention. Most of the programs evaluated tried to get to children before they were 1 year old. Almost a quarter of them tried to get to them before birth. Programs also differed by how long they were intended to run. Most lasted less than a year, and about a third less than 6 months. It's also important to recognize that some of these programs are, well, old. 4 of them involved cohorts that entered them in the 1960s. About half started before the beginning of this century. This is important for evaluation purposes because the world has changed over time. Usual care, or what a child might experience without the program, i.e. the control group, looked very different in the 1970s than it does today, when many more children go to preschool in general, or get food stamps, or Medicaid. The good news, as we get ready to talk about outcomes, is that 105 of the 115 programs were studied by randomized controlled trials. That's stunning when it comes to policy research. It likely just goes to show you how much people want to make sure these programs work. 19 of them were studied at a state level. 33 of them were studied at a multi-state level. There's a lot of evidence to discuss, and these studies were not small. The median for the biggest cohort to go through each of these studies for the programs was 244. The mean of those cohort sizes was 107,987. The latter is because the studies of transfer programs are huge. I should also mention that as we go, I will make reference to other similar reviews just to check things in the RAND study. This one is pretty much the biggest and most thorough around, but we'd be remiss if we didn't acknowledge that others exist. One good resource is the Results First Clearinghouse database, a one-stop online resource that provides an easy way to find information on the effectiveness of various interventions as rated by 8 national research clearinghouses. Another review we'll reference was conducted by the Community Guide, a collection of evidence-based findings of the Community Preventative Services Task Force. We'll put links to all this stuff in the video description below. A couple of years ago, they wrote a report on a 2014 meta-analysis of 49 studies of center-based preschool programs for low-income children aged 3 to 4 performed by the Washington State Institute for Public Policy. They looked at state and district early childhood educational programs, the federal Head Start program, and model programs like the Perry Preschool and Abedakarian programs. These are all in the RAND report too. Are you ready for some outcomes? So are we. That's the topic of next week's Healthcare Triage.